And there are new concerns from local health experts this morning. Last week, the state health department released new COVID testing guidelines, which discouraged some people from getting swabbed. But as CBS 4's Bobeth Yates reports, experts encourage testing, regardless of symptoms, is what's needed to stop the Omicron surge.
Well, the demand for COVID testing remains high, as just last week, the state had more than 397,000 new COVID cases. But that has not stopped the Department of Health from issuing new guidance discouraging testing.
We just want to make sure that testing is going to be of clinical benefit.
Under the direction of Governor Ron DeSantis, Florida Department of Health released new COVID testing guidance, which surprisingly encourages many people to not get tested.
If you're asymptomatic, maybe you were exposed, but you're probably not sick. You don't necessarily need a test because that's not going to improve your clinical outcome.
Jeremy Redfern with the Florida Department of Health says they are recommending only those with high risk factors get tested if exposed or showing COVID symptoms. But the move has sparked a lot of controversy, with many health officials disagreeing with the recommendation.
The guidelines that were put out are not public health guidelines. The public health guidelines have to be about the health of the public.
Epidemiologist Dr. Eileen Marty says COVID testing is necessary to control the outbreak.
Here you have this highly contagious virus that is generally contagious before persons manifest symptoms. And if we don't detect that by an appropriate test, this is going to have more and more spreader events.
In addition, Dr. Marty says testing will help health officials allocate resources.
We need to know that people have this virus and where they have it so that we have the necessary physicians, nurses, technicians, emergency response personnel.
And Dr. Marty says it's not just important to know that you have COVID, but also which variant, because that impacts treatment.
We know without any question that Regeneron does not work for Omicron. It does work for Delta. So if you know you have Delta, Regeneron's a good treatment if you're a candidate for that. But if you know you have Omicron, that's taking a risk without any benefit.
Bobeth Yates, CBS 4 News this morning.